that you're considering is an open source approach, which would tend to improve accessibility, lower barriers to entry, and hopefully with competition on the market, there will be enough innovative companies that provide the service that the cost will be driven down in that way. But there will still be some objective costs to the research, to the physical materials, the engineering, and initially these bodies will be expensive. That is a reality. Hopefully through some policy approaches like the ones that the US Transhumanist Party advocates, we can accelerate that time frame to accessibility for more individuals. But this is definitely a worthwhile discussion to have. And along these lines, Mike Lazine writes, he's 50 years old right now, and it seems based on the timeline that you put forward, not dying in 50 years would be very important to get the full benefit of these technologies. Mike Lazine writes, we need to reach longevity, escape velocity as soon as possible. And I agree with him. I think we need to do everything to keep ourselves alive for as long as possible. But I think we also should consider, when do you think it would be realistic for, let's say, a person of fairly ordinary means, maybe a middle class or an upper middle class person, being able to have a cyborg body? Do you have any time frame prognostications, at least enough of a cyborg body to prolong their lives so that they can survive until the next stage of technological advancements and maybe get an upgrade from that point in time?
Well, we even have a slide for this, even a set of slides. So let's try to answer on this question in the way, like, of course, we cannot predict the future, but we can, in some methods, we can try to approximate the future. So right now, when you develop any biotech product, let's imagine breakthrough product. Yeah, not easy one, not too complex one, but like a breakthrough product. You usually need around 15 years to bring one to the market. Yeah, you need to develop the first principles, then the concept of the product, assemble the core team while you are doing it, make experiments in rodents, in big mammals, and primates, pass all ethical barriers, then transition this to humans, pass clinicals one, do the scaling of your manufacturing, because you cannot just transition easily, like you need to scale your manufacturing. Then you can pass clinicals 2, clinical 3, then you will achieve some kind of product market fit with some expensive thing, and then other competitors will reproduce it, and then it will become cheap, available, and safe.